My name is Luke Maese. I'm an associate professor of pediatrics at the University of Utah and Huntsman Cancer Institute and Primary Children's Hospital. And today we'll be talking about the barriers associated with implementing asparaginase-based regimens in adolescents and young adults with ALL. When I think about this particular patient population, these adolescents and young adults, there are ubiquitous, I feel like, barriers that can be introduced and carried for them with any disease, but particularly with cancer and then with acute lymphoblastic leukemia. And those barriers, exist inherently due to the structure that we utilize in the medical field in caring for patients. We care for patients specifically in pediatrics and then specifically in adults, and then we have patients in the middle, these AYA patients, adolescent young adults, who may be closer to a pediatric age patient or maybe closer to an adult age patient. And then that's an actual number of years of how old they are, but also of their development, as this can vary across the age range. And because of that, it requires a little bit of understanding in both the adult and the pediatric age range and how this disease is treated. And there are not as many people as familiar out there in terms of expertise, and that could be any type of clinician, meaning a physician, but also supportive staff, including nurse practitioners and pharmacists and nurses and administrators, social workers, these types of things. And so when you don't have the structure that structure that's built around caring for a particular group of people, it makes it a little more challenging. And some of that structure can be reflected in what's implemented at your institution. So you care for patients in certain ways, and those ways may not be attuned to pediatric inspired regimens in cancer treatment, and particularly again in ALL. And if you don't have the familiarity with the regimens that are used, it makes it a little more challenging. And that could be from a clinician's perspective, but also again from an institutional perspective. We all use electronic medical records, and if you don't have the protocols embedded in your system, it makes it a little bit more challenging to care for these patients in a pediatric inspired way if you don't typically do that. Then we also think about the regimens that are used in pediatrics and the particular toxicities that could be introduced based on the intensive nature of our chemotherapeutic regimens, as children in general are able to tolerate a little bit more than adults. And so we have unique toxicities as adult protocols have as well. But if you're not familiar with some of the toxicities, some of these adverse events that can come as a part of treatment, then it can make it, again, unfamiliarity breeds a little bit more of uncomfortability, and that introduces barriers. I also think when we think about these patients in particular, right, they have unique backgrounds in terms of outside of their illness, right? So are they going through, certain things within their home life, their school life, their work life? All of these things kind of come into play, these psychosocial factors, when we're caring for AYA patients in general. And when you think about acute lymphoblastic leukemia and the intensive treatment that is involved, especially with these asparaginase-based regimens, you have additional things that you need to think about in those patients who may be working and you're trying to work around those things, or who may be living on their own and now they need to be supported by family members or loved ones, and working through that system. And then you also are working a time when they may be going off to college and school and these things. And so as providers, we think about these things for all of our patients. But as we think about asparaginase-based regimens and the importance of using them, these are things to address early on with your patients as we try to again reach these ultimate goals of getting past some of these barriers and getting the patients the right treatments that they need.